Cancer care is in the news, isn't it? Not for the right reasons, which is that working people in general receive an appalling standard of cancer care treatment, which is why survival rates from cancer in the UK lag far behind that of most West European countries, lag far behind the US. People have to wait for treatment, misdiagnoses, very poor follow-up. Not for all those reasons, that the dreadful standard of service that working people receive who are unlucky enough to get cancer, but because of King Charles. I mean, I'm totally opposed to royalty, so I find the terms King Charles to stick in my throat, but I'll have to use it. A bloated parasite who leads a grotesquely opulent lifestyle is holed up in some private London hospital having treatment for some sort of minor cancer. That's the news of the day. That's the cancer news of the day. It's a fucking cunting disgrace. What should be the news of the day is working people dying needlessly from cancer because the service is grossly underfunded by a Tory party who want medicine to return to being privatised and want to impose upon working people a process of pauperisation and impoverishment. And indeed, the Tories' secret agenda, well, it's not that secret, is to introduce or to reintroduce the Victorian Poor Law. Anyway, so I'm getting off track a bit. In that, I worked for the Care Quality Commission for many years, which is the national regulator for health and social care in England. I think there's a different one for Scotland or some fucking thing. It doesn't really matter. It was the regulator for health and social care, and I've said in previous posts, which have now been deleted by TikTok, that CQC is a failed regulator. This is an obviously and demonstrably failed regulator. His reports are garbage. They're not worth, trust me, they're not worth the paper they're written on, the garbage. CQC is a failed regulator. The reports are purely random, based on a sort of methodology that is grossly incompetent, and comes out of a sort of swirling mix of ego, bias, and fads of the day. Anyway, one of the fads of the day for this story is when cancer care, it was a few years ago now, cancer care was in the spotlight, and CQC was doing, and as a result it had been told by the Department of Health to go around to cancer care wards and to do an inspection of them. And I was told to go and do an inspection of the cancer care ward at the Canterbury Hospital. It's called Cathedral Unit. I don't know whether that's because it had a view of the cathedral or whether there was some sort of religious reference. If it was a religious reference, it seems pretty inappropriate, doesn't it? Because the people who were patients of Cathedral Unit had a pretty bad deal from God, hadn't they? Because they'd been fucking given cancer and they were going to die young. That's the fucking truth of it. Anyway, I said to the person who'd given me this directive to go to this Cathedral Unit to do an inspection, I said, I pointed out I was a social worker for older people, and the person who was going to go with me was a learning disability nurse. Neither of us knew the first fucking cunting thing about cancer or cancer care, other than we didn't want it ourselves. The first fucking thing, she said, this person said, I don't give a fuck about that. Just go to the ward, find something to say about it, find something positive to say about it. Don't come back with any fucking problems. Go and do the fucking inspection so that we can say we've done an inspection. Don't find any fucking problems. Come back and write a good report for it. Fuck it. That's the mantra that, I've been told, and that's what you're fucking going to cunting will do. So we went along to the ward, and we muddled through for the day, talking complete bollocks. talking complete bollocks. And we came away, and as we were coming away, the girl that I was doing the inspection with burst into tears at the end of it, and she said, I spent all day talking drivel about this ward where people were going to people going for the day. It's a day ward. People were going to be filled up with hideous fucking chemicals that had all sorts of unpleasant effects on their body, as well as hopefully in killing some of the cancer cells they had. She said, I've spent all day with these people who are in a dire situation, talking complete rubbish, and I feel I'm a complete fraud. I think it's a fucking disgrace, she said. I think it's a fucking disgrace, she said. I've got a good mind. I've got a good mind to contact the media about it, to say what a scandal it is. What a scandal it is. But I managed to impress upon her that she'd got children to feed, and getting in touch with the media about it wouldn't be a good idea, because she would find her position in CQC sort of untenable very quickly. Anyway, I managed to persuade her, and we wrote the report, and it got passed and published, and that was the end of it. But it's a fucking disgrace, isn't it? So the idea that cancer care services were being subject to robust and prudent and proper investigation by CQC is completely false. I mean, it is completely false. That was not the case then. It was a complete fiasco, a debacle. Not only were working people not receiving, in general, not receiving the quality service they have the absolute right to expect. They're the absolute right to expect. But even the regulation of those services wasn't top quality. Well, it wasn't any fucking quality. It was garbage quality. A fucking disgrace. I've said on previous posts, which have been deleted by TikTok, that CQC is a failed regulator that should be abolished. I mean, it's demonstrable that it should be abolished. I've said it on previous occasions, this fiasco about the cancer care inspection in inverted commas that we did at the Cathedral Unit, KNC, is one more example of why the Care Quality Commission is a failed regulator. It's a failed system of regulation in which the public can have no confidence whatsoever. And that's the real story. The real story of cancer care is the lamentable standards of cancer care in the country, in the UK, the lamentable survival rates in the UK, and the lamentable system of regulation.